Anything?
Let me see.
So then do I have to then go back to, how do I get back to the screen?
I see you live. I see you on YouTube. If you go top left, there's like editor.
Yeah.
That'll bring you back to the seeing yourself.
Okay. Cool. Can you hear me?
All right. I'm gonna hang up because I think I see you on the YouTube live.
Okay. All right.
Yeah, I'm just gonna leave.
Test. Can you guys hear? Work? Test. I'm just catching up. All good? All right. So you guys can hear. Well, welcome to the Vista Apex YouTube live event. Got a little bit of a late start because of technical issues. It's one of those things where you start to use a new platform. I was just getting good at Zoom and then Teams and a few of the other programs for webinar like meetings, and then we decided to use YouTube Live. And so YouTube Live is just getting used to some of the software. And for some reason, I had to switch cameras, so I'm going to raise this up a little bit so I'm not looking down so much. So what we're doing is we've used a new software to get the, I'm going to using a new software, and I'm just trying to get used to it. As we switch into the software, it kind of pops my camera and my audio off for some reason. So we can't figure that out. Is it a hardware thing or is it a software thing? Anyway, just wanted to say thank you for joining. I'm going to go ahead and do this for a little bit, just if nothing else, so we have the recording. So if you joined us on time and I was late, then hopefully you can catch this recording. If you did join us on time, thanks for joining us. And I was just saying that this was one of those days that it's that you look at your schedule and think, oh, I got this day. And then it turns out that even the easy things turn out to be really hard. But I had really good patience. And so by the end of the day, I got a smile on my face and the patients had a smile on their face. It's just there was nothing easy about this afternoon. Well, what I want to do is take today and kind of talk about one of the reasons why we're doing these YouTube lives and kind of a little bit about Vista Apex as a company. So one of the reasons why we wanted to, and I alluded to this during our last YouTube live, the reason why we want to do this, or that I really want to do this, is to create more of a community. Because a lot of dentists, it's funny, we're either by ourselves, and so we don't have a way to share a lot of different ideas, or we might work with a group. But I mean, I've worked with other dentists before, and we're so busy we don't have a chance to really sit down and talk. Sometimes you're lucky enough where you're, during your downtime, you do have a chance to talk with colleagues. But I just wanted to have a chance to share with you kind of what Vista Apex is all about. And then I am a wet finger dentist. I've been practicing now for 37 years. My practice is in Sacramento, California. And because we're in the capital of California, we are kind of a town where everybody has insurance, especially Delta Dental. And so what we've had to do is, as insurance has made it harder and harder to practice, is we have dropped our insurance and we're fee for service in a town where most are still taking insurance. And so somewhere down the road, we'll talk about that. There's some podcasts that we put out also on the Vista Apex website where in part one, once it's posted, if it hasn't been already, that I talk about kind of the history of when I got out in practice and I was taking dental insurance, kind of reminiscing about the good days of dental insurance. And then there's going to be part two to discussing a little bit more about that. And part three, I'm going to give kind of just 10 steps that when I'm talking to colleagues, because colleagues will come up to me and ask, well, how can I, decrease my dependence on dental insurance? It's just 10 different steps I'd recommend that clinicians follow. I know some of my friends will just say, I'm done with insurance and they drop it. Would not recommend that you do that. And even before you drop insurance, you really might want to make sure that that's going to be something that your practice can actually survive. So, we'll share some ideas about that. But going back into why we're doing these types of webinars is just to create a sense of community. What I encourage you to do is send us your comments. If you want to comment, hey, you were late, I'm good with that. But if you have comments of, I want to do more of a particular type of case, we can share our ideas within this format. And that's really what I look forward to do. I want to go back and talk about Vista Apex as a company, though, because Vista Apex, it's a unique company, and I'm proud to be a clinician associated with Vista Apex. If we go back and we look at Vista Dental Products was a company founded around 1997, based out of Racine, Wisconsin. And one of the ways that they kind of became a well-known company was in the development of advanced endodontic irrigation solutions. So when I was in dental school 40 years ago and we were learning to do root canals, we were doing hand filing the whole thing. It could take us hours to finish a molar root canal, find all the canals, enlarging the canals, starting with an 8, going up to 10, 15, 20, 25, 30, 40, 45, wherever we might end. And during that time, we were using sodium hypochlorite as our irrigant. Well, having that root canal, having it taken an hour, that sodium hypochlorite really had a good chance of cleaning out the canals. Because as we know, our endodontic files don't touch all the walls of the canals. Maybe we miss 50 to 60% of the canal walls. And that's just because our files have been historically a little stiff and the canals are tortuous, and it's hard for our canal to scrape the walls of those canals. So we depend on our irrigant to get down there, touch the walls, clean the walls, and disinfect. Well, Vista at the time was doing a lot of these studies on surfactants, and the surfactants really made the wettability of our irrigants increased. And what that meant was that our irrigants, the sodium hypochlorite equivalent, could get in there and dissolve the tissue much faster. So today, as we're using our rotary files or reciprocating, we're getting up into the canal, and the mechanization of our handpieces does most of the work. Well, we need an irrigant that can disinfect the tissues as quickly. And so Vista had a line of irrigation solutions that could keep up. And so a couple things. When I was in dental school, we were taught to use Clorox. You could dilute it if you wanted to. But one of the things that we have found out is that if you use Clorox, you don't really know what the concentration is. And so I know sometimes if I'm doing an endodontic lecture, doctors will say, well, should I use a 3% sodium hypochlorite? Should I use a 6% sodium hypochlorite? And you'll ask them, well, where do you get your sodium hypochlorite? Well, it's from a Clorox bottle. Well, to tell you the truth, in a Clorox bottle, because it's made to whiten your clothes and to disinfect, we really don't know what the true concentration is. The Clorox, the bleach is manufactured, and as it's transported, if there's heat or a lot of sunlight, the concentration of that sodium hypochlorite decreases with time. So by the time you get it, you don't know if it's 8%, 6%, 3%, 2%. You really don't know. And if it's down to 3% or 2% and you dilute that to 50-50, well, now maybe you're lucky if you're using a 1% sodium hypochlorite, which is almost like doing a root canal just using water. And we all know that when we do root canals, we don't want to use water to expect that to dissolve the tissues or disinfect. So that's one of the things that Vista was really focused on is working on surfactants. one of the things that I really like about Vista's products is the hemostatic agents, because when we're doing aesthetic work and we're working on the anterior teeth, we don't like the ferric-based hemostatic agents because it discolors the gingiva. And even though we tell the patients, hey, when you leave here, give it a couple hours, it's going to kind of go away and you're going to be fine. They look at that dark line up the gum line and you've just done a veneer or crown or maybe a really nice composite, and that detracts from that final result. Well, using that surfactant technology, and we'll talk about this more coming up in future YouTube lives, is that we're able to use a clear hemostatic agent and, in my opinion, get as good results as we would with the ferric based and not have that tissue discoloration. So we're going to be excited to talk about that. Well, you had Vista over here. Then you had Apex Dental Materials. Now, Apex Dental Materials, we had Dr. John Kanka III. Dr. John Kanka was an innovator in both adhesive dentistry and aesthetic dentistry. So what Dr. Kanka told us is that we could actually apply phosphoric acid to the dentin and not kill the tooth. Now, when I was in dental school, we were told never to apply phosphoric acid to the dentin. We could apply it to the enamel because there weren't any tubules where we could harm the dental pulp. But we were told not to put it on the dentin. Whereas today, if you did a composite today, I did, we just put the phosphoric acid on both the enamel and the dentin. We put it everywhere, and we did not fear killing the tooth. Another thing that Dr. Kanka taught us is that when we place our adhesive, it's better actually to place the adhesive on moist tooth structure, not bone dry tooth structure. That we get better permeation of our solvents to carry the resin into the dental tubules if they're slightly moist. Whereas when we were taught to do adhesive dentistry, I was taught not to put the phosphoric acid on the dentin, only on the enamel, then rinse it off, get it bone dry, and then apply your adhesive. So 40 years ago, in the days of doing adhesive dentistry, we were doing a lot of things wrong and wondering why our restorations were falling off and why patients were having sensitivity. Well, Apex, under the guidance of Dr. John Kanka and Scott Lamoran, who is the chemist who developed this new line of adhesives that Dr. Kanka kind of authored out, Apex was developing kind of this one-of-a-kind type of adhesive that eliminated basically all sensitivity. So a little slightly different protocol, some different adhesives, and that put Apex on the adhesive dental map. Well, in about 2019, Vista and Apex joined, and we became Vista Apex. So now we had Vista that was making all these great solutions and some small equipment. We have Apex with all their adhesives and restorative materials, and we became one company. Of recent, in the last couple of years, Vista Apex and ParaProtect have kind of come together. ParaProtect was founded by Dr. Dwayne Keller, and Dr. Keller was trying to figure out how to treat periodontal disease basically non-surgically. Things have been done, surgery has been done for a long time, and then antibiotic solutions were thought about. Can we put antibiotics maybe even in the sulcus? Well, Dr. Keller came up with a non-invasive periodontal therapy where by using trays, but these trays were developed so that right around the sulcus area, they're very snug and tight around the neck of the tooth. And as the medicament, basically a low concentration hydrogen peroxide. So we put the hydrogen peroxide in these trays, seat the trays in our mouths, or our patients do it in their mouths for 10 to 15 minutes, either once, twice, or 3 times a day, depending on how bad their case is. We could resolve a lot of gingivitis, periodontitis. Today, we're actually looking at it to help keep our implants healthier. By doing this, we can get rid of a lot of the gingival inflammation, which we know will help their oral systemic health. The byproducts, because the active ingredients is a 1.7 hydrogen peroxide, is you have fresher breath and whiter teeth, and all things that our patients want anyway. So today we have Vista Apex. Now we have ParaProtect trays coming together, and we call this kind of partnering in total tooth care. So from the apex of the tooth all the way up to the crown, we have our endodontic product line, we have a restorative product line, we have around the gums, we have a periodontal health product line. So now these companies have come together, and it's an exciting time because now we have a way of treating patients from the apex all the way up the tooth and around. So Vista Apex is now based out of Racine, Wisconsin. It serves about 65 different countries around the world with about 95 to 100 employees. So it's really a nice sized company. And because of that, it's not a huge corporate giant. We are partnering with our colleagues to support your success. Back in the days of COVID, we were doing webinars because at that time, everybody was trying to figure out what am I going to do with my free time. Everybody wanted to expand their clinical skills so that when we got back in the clinic, we were ready to go. And so Vista Apex has a library of some programs that we did during that time. And you're welcome to go check out the Vista Apex website. And you'll find that there's some online, on-demand type of education there that if you take it, you can actually get some CE yet. So we've got all kinds of different products, restorative, endo focused. If you do any type of restorative, like when I place my composites, we have a bioactive composite line called Regen. The Regen line, which we'll talk about in future YouTube programs, is really based on Bioglass 45S5. And the Bioglass has a chance to actually help the body and the tooth create more hydroxyapatite. So we'll talk about that. If you are doing zirconia restorations, a lot of my colleagues tell me that, yeah, they've moved into using zirconia away from, let's say, Emax. So they're using zirconia, might be a little bit stronger. They've moved away from gold and PFMs. They want something that's aesthetic. So you look at the zirconia and they're cementing them on and not bonding, but just cementing them. And they're having problems getting those restorations to stay on. Well, when I use zirconia, I like to bond my zirconia on. But when I try my zirconia crown, let's say on tooth number 14, invariably I'm going to have salivary contamination. The salivary contamination is going to mean that there's phosphates that get on the internal aspect of that zirconia restoration. And when I try to, let's say, bond it on, I'm not going to get good adhesion. So Vista Apex, we've got ZRC, a cleaner that is better than any that I've used before, and ZRP, which is a primer to primer zirconia so that it stays bonded to our luting cement and to the tooth. So we'll talk about more of that coming up in the future. One of the great things I like about working for Vista Apex is we recently had some studies done about the industry, and our satisfaction score was higher than some of the corporate giants out there. So we're a company that's an innovative company developing things that no other company has, and yet when we deliver those products, our customers actually truly like the products. Now, because they like the products and they're a little different, that's one of the reasons why we like to provide this education, because through the education, we can show you how to use the products successfully. So 2 reasons for these YouTube lives is 1, to make you aware of the products that we have. And then 2, it's going to be to show you how to use the products. Because I don't know, a company can have the greatest products out there, but if clinicians don't know how to use those products, and so the performance of those products fails, then we have not done you a service. A little background on Vista Apex as far as from an R&D perspective is Vista Apex has their own R&D team. We have chemists and biomedical engineers developing our small equipment and developing a lot of the chemical components that we sell, whether it be a composite, adhesive, different solutions that we use. So we developed that within the company. And then here in the US, we manufacture a lot of what we sell. Where can you get the products? You can get it directly from Vista Apex if you go to the website, or most of the major dealers sell our products. So widely available. We also have little delivery tips. Those of you that do endo these days and you are using some kind of bioceramic sealer, that bioceramic sealer is costly. And so we have what's called MST tips. And with material saving technology, less waste is in that tip. And therefore, you're going to get more treatments, more canals filled with every syringe of that bioceramic seal that you use, which is going to help drive down the cost of doing business, which is better for the practice. So we'll talk about things like that. We'll talk about the different tips. We'll talk about different irrigation protocols. all of those things are what really makes me excited about being able to share this information with you. Again, what I hope you're able to do, especially as we get this technology all ironed out and I show up on time next time, is send us your comments, send us the questions, things that you're interested in. My background is like I mentioned before, I've been in practice in Sacramento, California, where I started 37 years ago. Still hopeful to go another 30 years. Not hating dentistry at all. Actually loving it. I know I love seeing the patients, and I always think about coming to work, and I'm just treating my families and friends. And I hope I can make dentistry like that for you too. Again, I teach different types of courses. I teach an aesthetic course, live patient treatment course. I work with a local dental lab, Core Dental Lab, and Core Dental Lab is uh, a sponsor of a live patient treatment course that we do locally, and we're going to spread out back nationally. We used to do it across the United States. During COVID, it kind of contracted the ability to do live patient treatment programs, but we're holding our first one here in Northern California this year. We're holding quarterly study club meetings, and we'll have our live patient treatment program in our first weekend in October, where we'll prep out our patients' teeth, and then the first weekend in November, we'll seat all the restorations and do a follow-up with our groups in December. I also teach occlusion programs. I think we'll be teaching an occlusion program coming up here in the fall, next month in September. Teaching endodontic program in California in October. And then teaching other courses in the past, everything from lasers to endo restorative to just basic restorative. So I love all parts of dentistry, and all parts of dentistry involve taking photos. So we can talk about photography. I just throw this out there just so you all know that any topic that you hope to discuss, I'm open and game for doing that. I learn from every time I interact with my colleagues, other clinicians, I learn. I look forward to that. So what I'll do is wrap this up right about now. Just want to thank everybody for your patience. We will get this ironed out by the next time we're on YouTube Live. I'll figure out the software, and we'll figure out what cameras I can use and what mics I can use that won't shut us down. But been great spending time with you, and we're gonna look forward to more topics. And sometimes we'll have some guests. We'll bring in some of our R&D people to give us the background story on the development of some of the equipment and the materials that I use in my practice. Okay? So we will sign out, and thank you very much, and I will see you all